First, we'll review a little bit of basic anatomy of the eye. The front structure is called the cornea, which is an important lens component. Just behind that is the crystalline lens, also an important lens component. The space behind that is filled with the clear vitreous fluid, which is 99.9% water, with a little bit of collagen admixture. Behind that is a particular density of collagen, which corresponds to the optic nerve head as it enters into the eye. Normally, this is not seen unless it were to separate and hover or suspend itself in front of the retina, where it will cast a shadow. Here is a cartoon schematic of the eye drawn in the opposite direction, and showing here some of the aging effects of the vitreous. One of the effects is a thickening and a pooling or puddling of the water component. Typically it forms in the center, and occasionally there will be a shift of that central puddle of fluid to the back part of the eye. When that occurs, the back part, the posterior portion of the vitreous, may separate from the underlying retina, peeling itself away. That ring-like density that was mentioned earlier can come off with the wall, and now you have a dense ring-like structure suspended in front of the retina. Here we return back to the anatomical illustration showing this density or thickening of the vitreous in the center as it has collapsed and pulled away. This is the posterior vitreous detachment. That particular density that was at the optic nerve head has pulled away and is now suspended and quite well positioned in the center part of the eye. As the light enters the eye, it will cast a shadow now, and as that fluid jiggles and moves about with eye movement and head movement, the shadow will move about. So that is what a floater is. These Weiss rings are just a particular type. Sometimes they're ring-like, sometimes they will collapse, sometimes they're strands and fibers or arc-like shapes. They can have any number of combinations, but the Weiss ring really is quite a classic one and stands out quite well when we examine the eye. So for those of you trying to figure out how I actually treat the floaters, here's again another cartoon schematic showing the layout. The eye obviously is shown here. There's a contact lens that is put on the numbed or anesthetized surface of the eye, so the patient doesn't really feel it at all, and I hold it in place. And with small eye movements and in a completely adjustable laser, there is a focusing of the laser beam in a cone-shaped pattern onto the surface of that floater. There is no energy absorbed at the cornea or through the lens or on the other side of that floater at the retina. And so I have a really quite accurate focus in delivering the energy to that floater. The duration of that YAG laser pulse is about 20 nanoseconds, which would be equivalent to about 0.0000002 seconds. Very, very short duration, and the energy essentially vaporizes that tissue. So here's what that ring looks like to me looking through the optics of the laser. And these are difficult to photograph, but as I swing my light source back and forth, you can appreciate a ring-like structure. And the bright red lights in the background are the overlapping red focusing beams. And occasionally you'll see those red beams kind of light up on the surface of that ring-like structure. And that's what I use to focus. So again, we kind of move the eye a little bit, move my light source back and forth. And you can see that this ring does not float freely around as if it were in clear water. It remains somewhat suspended in the same position with a little bit of movement. And I apologize for the video quality. My view is always much, much better than this. And there's a freeze frame of it showing it frozen in place there. So the treatment strategy is to try to get everything lined up just right, optimizing the laser energy. I have my two red focusing beams, and when I get those two perfectly lined up right on the surface of that laser, I'll activate the laser. There we go. And there's a freeze frame. And in doing so, I have broken part of that ring. You can see a little bubble or bubbles floating away with each shot of the laser. And those bubbles are micro gas bubbles, probably carbon dioxide, of the vaporization of that collagen and semi-solids. There's a freeze frame of an actual plasma burst. That's how the energy is imparted onto that floater. And the key is you just have to be diligent, and it's a war of attrition. You do it over and over and over, and gradually over time you will end up with less material present. And you notice that even it's a very dynamic process. There is some movement of that material. But if you're diligent enough, you can actually reduce it. So now we've jumped ahead here. This is probably after 20 or 30 minutes of treating, and I've switched to a different lens. It has a little bit wider angle. I have a little more depth of field with this lens. And I'm just going back and finding small little fragments that were left. These are some small little pieces that I'm hitting here. You can see a couple little bubbles going away. And in a moment, I'm going to do a wider scan, and we're going to scan the quadrants here to show you that that floater that was there 20 or 30 minutes ago is essentially not there. This is, I think, a strong argument and good evidence that when some people say that, well, the floater just, the laser just breaks the floater up into smaller pieces, and so you're left with a lot of small pieces. Well, if you look around here, as I'm doing with this lens, scanning back and forth and all the different quadrants of that sphere, that ring is just not there. That floater material is just not there. The Weiss ring floaters are my absolute favorite because you get nearly immediate gratification. The patient gets nearly immediate gratification, and they require the least amount of treatment. You sometimes have to go back and do a little tidying up, a little cleanup, a little touch-up procedure to get some of the fragments that were moved out of the way. But this is an opportunity to cure that floater. And what's really amazing is this is a procedure that many of my colleagues say does not exist or couldn't or shouldn't be done. I'm going to tell you, this patient was very, very grateful. She had similar floaters in both of her eyes, and over the course of a couple weeks, they were completely eliminated, and she should never get those floaters back ever again. That was a one-time deal for her, and consider that a cure.